Okay, 5 minutes on cancer and palliative care, just to get a flavour of this particular mind map. As usual, a mixture of resources from basic ones but useful for both doctors and patients, such as BBC Cancer website, more specific ones such as the Gold Standards Framework website. There's also this excellent downloadable wall chart from the Department of Health, and though most of us or all of us have individual guidelines based on our local hospitals, this is all on one page, which is really useful. Here we have Bandelier, and they have a specific section on cancer, for example, aromatase inhibitors in advanced breast cancer. This obviously is useful. Cancer pain, this is looking at complementary and alternative therapies for it, something that patients are often interested in. Remember to look at the UK health priorities. You just have to hover over there, or in this case I would actually click, and then remember to grab that and pull it across so you can read it full screen. There's a link here to the National Cancer Plan, but in addition to listing the 20 most commonly diagnosed cancers, there's also links down here to UK cancer incidences for men and women. Useful data. To close it, remember to press this cross rather than the two up there. Moving on to primary care management, we're meant to understand screening programs. That's a link into the Department of Health. Hovering tells you a little bit about that link. Moving on to Wilson's criteria, again hovering here will list the 10 criteria. And why is prostate screening not done? Clicking there will take us to the page which gives you the answers. Now about the epidemiology of major cancers and risk factors. So this is really a link into the 10-minute consultations from the BMJ, one of my favorite resources. And as always, these are scenario based. A 42-year-old, 44-year-old woman attends your surgery distressed. Family history of breast cancer, again a link. Risk of developing cancer. And this page not only gives you statistics, but also clicking there will take you to their website on understanding risk and absolute versus relative risk. Often if things are in green, it means it's an addition. So I've just talked about the palliative care and what's meant by supportive care, and indeed palliative care itself, and a link really just a hover there to look at NICE's definition of palliative care. Looking briefly at person-centered care, the ability to attend to the full range of physical, social and spiritual needs of the patient and carers, and I put in how would you help a young widowed mother with 3 children, and just a little thumbnail sketch, ICE, financial, physical, social, psychological and familial, just as a quick aide-memoire. We've got to be able to communicate effectively and break bad news. So this is an example of how you can put in a link. I think YouTube is great, and I've put hard-hitting roleplay using an actor. You click on it, and suddenly you find that the video has been removed by the user. Well, just cultivate a flexible attitude, type in breaking bad news, hit search, and you've got a whole vista of them. This is a good one, breaking bad news badly. Very helpfully put on by the Pennine GP training scheme. Thank you. So obviously, depending on your learning needs, you can go for things which are more robust. If I click on there, patient.co.uk, Patient Plus, excellent article with good references. And if you want regional guidelines, we've got these ones from the National Council for Hospices and Specialist Care. So essentially, have fun with the map, go round it, use the various resources that are there. In some instances I've put in a link. For example, pain management goes through to the BNF section on pain. In other areas it'll just be individual websites or useful resources, for example opioid conversion charts, or use Google and find your own resources. Just identify your learning needs by looking at the various areas that the curriculum highlights, and just work your way around the map, either in order going clockwise or take whichever path you fancy. So just click on the link below and start playing with the map yourself. Thanks for listening.